تقضى به الحوائج وتنال به الرغائب وحسن الخواتيم ويسر.
Assalamualaikum warahmatullahi wabarakatuh, brothers and sisters. As you are about to begin, kindly switch off your microphones to avoid any audio interference and give your full attention when our speakers deliver their talk. You are also encouraged to switch on your camera and use the background given as a sign to support this program. Your cooperation is highly appreciated.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
Terima kasih.
We are waiting for the other panel, inshallah, before we're going to start. Inshallah, we'll be starting shortly. As I've been mentioned earlier, you are encouraged to switch on your camera and use the background photo given as a sign to support this program. Your cooperation is highly appreciated. Brothers and sisters, this program is about to start. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahi rabbil alamin. Wa afdaluha wa atammu taslim ala nabiyil amin. Wa ala alihi wa sahbihi ajma'in. Amma ba'd. Praise be to Allah subhanahu wa ta'ala. We have been graced by this opportunity to gather in this program. I am Muhammad Umar bin Muhammad Nashrin, and it is an honor to be your MC and moderator this evening. On behalf of the committees, I would like to extend a very warm welcome to all of you. Let us begin our program with 𝐼𝒂𝒏 al-Fatiha. Our Honorable Dr. Ahmad Zuhdi bin Suradin that will be with us shortly, inshallah, and Assistant Professor Dr. Noor Yuslida Binti Hazahari, the panelists of our program tonight. Associate Professor Dr. 𝐼𝒑𝒉𝒆𝒏 Binti Fatah Yasin, Advisor of Qur'an and Sunnah Studies Students Association, QUSSA, Brother Adlan Shahmi bin Azhan, President of Qur'an and Sunnah Studies Students Association, QUSSA 23-24, committees, brothers and sisters. Again, Assalamualaikum warahmatullahi wabarakatuh, and a very good evening, I bet, to all of you. In order to gain barakah, I would like to invite Brother 𝑖𝒑𝒂𝒏 to lead the recitation of dua. فَلْيَتَفَضَّلْ مَشْكُورًا. Please welcome.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma salli ala sayyidina Muhammad wa ala ali Muhammad. Allahumma barik lana fi Sya'ban wa ballighna Ramadan. Ya Allah, Ya Fa'al lima yurid. We express our gratitude to you for allowing us to join this forum on infectious disease tonight. O Allah, we ask you for the safety of our religion and the welfare of our body. O Allah, Lord of the implementing authority, make the days that we have gone through, starting with your mercy, continue with your blessing and righteous guidance, ended with the forgiveness. Make the days that we have gone through spent in your obedience. Adorn us with the adornment of the righteous and clothe us with the ornament of the pious in spreading good behavior. Ya Allah, Ya Muhaimin, Ya Aziz, Ya Jabbar, let our effort as a means to enlighten and convince ourselves that the personal safety of either outer or inner is a prerequisite for achieving happiness and excellence in various fields. O Allah, grant us faith and strength to face the challenges of life. O Allah, show us guidance and adjust our paths and ways to achieve happiness and glory. O Allah, bless our life in this meeting and gathering and prevent us from harm and unfortunate events. اللهم اجعل جمعنا هذا جمعا مرحوما وتفرقنا من بعده تفرقا معصوما ولا تجعل اللهم فينا ولا من يتبعنا شقيا ولا مطرودا ولا محروما ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Jazakallah khair al-jaza, Brother 𝒖𝒑𝒂𝒏, for the beautiful recitation. Before that, ahlan wa sahlan to Dr. Zuhdi. Brothers and sisters, Forum on Infectious Disease that is Preventive is a program organized by the Qur'an and Sunnah Studies Students Association, QUSSA, in collaboration with Murabi IIUM. Our main objective here is to share information on infectious diseases and the most effective prevention methods in which we will be discussing misconceptions and false information regarding infectious diseases and attempt to further the use of evidence-based in public education. Hence, we specifically brought to you two authorized panels who may elaborate and share regarding the topic discussed in detail. First, we have Dr. Ahmad Zuhdi bin Suradin, a medical officer at IIUM Sejahtera Clinic. How are you, doctor?
Hello, Assalamualaikum.
Assalamualaikum.
Dengar? Okay, Alhamdulillah. Thank you.
Alhamdulillah. The next one, we have Assistant Professor Dr. Noor Yuslida Binti Hazahari, lecturer at International Institute for Halal Research and Training INHART, as well as a member of Murabbi IIUM. Doctor, how are you?
Alhamdulillah.
Alhamdulillah. I hope all of us are in the pink of health and best condition of Iman. Lecturers, brothers and sisters, now let me brief all of you about the flow of our program tonight. Firstly, we will have 2 rounds of sharing in which I will throw a question to both panels for each round respectively. After that, we have a Q&A session in which we will allow and encourage audiences to ask questions to be answered and clarified by our panels. As for the final round, the panels will be given an opportunity to conclude our session today. Then, inshallah, we end the session with closing remarks and photography session. Without further ado, let us begin our discussion now. Bismillah. Dr. Zuhdi, for the first round, could you explain about infectious diseases in detail for us to deeply understand the concept and have an overview regarding it? With all due respect, please welcome, Doctor. The floor is yours.
Okay, Assalamualaikum warahmatullahi taala wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillah rabbil alamin wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli, amma ba'd. Thank you, organizer, for having me today. I think the organizer QUSSA, right? Qur'an Sunnah Student Association.
Yeah, QUSSA.
Yeah. Okay, thank you, Mr. Chairman, Brother Muhammad Umar, our panelist, Dr. Noor Yuslida. This is our first time being on the same stage. Dr. Rauda, thanks for giving me opportunity to share some knowledge about infectious disease. Alright, actually the infectious disease is a very big topic. Actually, it's a subspecialty in medicine. Okay, it's a very, very big what we call subspecialty in medicine. So this one, I'm sharing this topic is actually based on my experience handling patient in IIUM Sejahtera Clinic Gombak campus lah mainly. Alright, next slide please. I have only 15 minutes, Brother Omar, for this question.
Yeah.
Because initially I was mentioned 25 minutes, so I need to be rushing a little bit lah. Okay, alright. What is infectious disease? Okay, infectious disease in Malay we call penyakit berjangkit lah. Okay, in Malay words we call penyakit berjangkit. Okay, in Arabic word they call al-amrad al-mu'diyah, penyakit berjangkit lah. Okay, we have mashallah here we have a student from Qur'an Sunnah IRK HS. So infectious disease basically contra with non-communicable disease. So infectious disease we have penyakit berjangkit, contra with non-communicable disease, penyakit tak berjangkit. Okay, for example, what is penyakit tak berjangkit, non-communicable disease? Diabetes, hypertension, obesity. That one not infected to other people. That means if I stay near to you, close to you, it will not transmitted to other people. Okay, but infectious disease, you can transmit the disease from one person to other person. Okay, through via several mechanisms. For example, through droplets, through airborne, okay, sexual transmitted disease, zoonotic through animal vector, mosquito. Okay, so yeah, this is basically infectious disease lah. Next. So in infectious disease, we have something we call incubation period. Maksudnya incubation period. So I mix English and Malay a little bit. Okay, incubation period means okay, let's say the germs enter your body, it will not straight away infect you. For example, COVID, let's say you get exposed to COVID virus, it will take 2 to 10 days. Some people say 2 to 14 days for the germs or the virus to replicate in your body. The slide, please. Slide. Okay, common cold, for example. Common cold quite biasa. Common cold, what is common cold? Common cold ni biasa, like like you have runny nose, fever, sore throat. This is commonly caused by virus. Common cold usually 2 to 5 days. That means if you got infected from your friend, after 2 to 5 days, you will get the manifest the symptom. Okay, we have influenza 1 to 2 days. Sore throat that caused by virus. Okay, 2 to 5 days. If TB, tuberculosis, TB ni, if we call a lazy disease, dia slow sikit, slow progress. Will take around 6 to 20 months before the person get infected. Next slide. Okay, so infectious disease, we have incubation period. The term is incubation period. Previous slide, brother. What is contagious period? So ada dua term lah. Satu we call incubation period. Number two is contagious period. Contagious period maksudnya means on that particular time, that means if I got infected by the illness, let's say COVID lah, we say COVID lah. So how I can infect? That means there is a period we call it contagious period. That means very likely I will infect other people even before I have the symptom. Okay. Some scholars said until 10 days after you got you have the symptom, because right now the what we call the quarantine period, they make it to 4 days only. So after 4 days, if you still have the symptom, we advise you to still wear the mask because you still have the chance to infect other person. Okay, next slide please. So is infectious disease related to IIM community? Yes, because we have a lot of patients come with with infectious disease. Very common is common cold lah, cough, sore throat, fever, kan, mild symptom like that, usually caused by virus. Okay, we have COVID. After this, I will explain to you what common disease infected our community, especially in Gombak campus. Next slide, please. All right, so we go very fast. What Islam said about disease and prevention, you can see in Hadith Bukhari. Okay, that means in Hadith from the Sa'ad ibn Abi Waqqas said that if there is a disease we call ta'un, idza sami'tum bit ta'un. Ta'un ni kalau in medical term, scholar have different opinion. Okay, but some scholars have opinion the ta'un term refer to plague, P-L-A-G-U-E, plague. This is a very infectious disease lah. Okay, so if you heard about ta'un in one place, Rasulullah said don't enter the place lah. But if you are in the ta'un place, you cannot go out. That means this is the what we call the basic of quarantine lah. All right, next. So we can see here Rasulullah said, leave the place as it will cause harm if you go there. We are talking about the endemic happened in a place called Abyan, okay, in the riwayat Abu Dawud. Also Islam also emphasizes us to avoid harm. In Surah Baqarah, I think you are no better than me lah. In Surah Baqarah verse 195. Okay, next. And then the fig method, I think you are more expert than me. The harm should be eliminated. That means the harm is referring to the disease. Okay, so you as a student, especially in what we call in Islamic study, kalau we are referring terpaling Islamic among the student in UAE is Islamic, the student from IRK lah, right? So you should show the what we call the good example to other students lah. All right, next. So type of infectious disease. Actually, okay, next slide please. Okay, type of infectious disease. This one, actually we have a lot of example of infectious disease, but this one is it's not really common. This is the disease that that's happened in our community lah. The first one is we are divide the infection through method of infection. Number one is airborne. That means merebak melalui udara. Okay, that means the germs expel from one patient and like fly lah in the air. Okay. And also the other term we call droplet. So what is different between airborne and droplet? Droplet means daripada air liur dia. Maksudnya if you go close contact with the patient, droplet. But more dangerous is airborne because it can fly in the air. Okay, for example, COVID lah. Okay, COVID. You all know about COVID, right? So COVID is, I think all of us are already graduate from from COVID. We know a lot about COVID right now. Not at the initial phase where we don't know how COVID act. Right now, the COVID I can say is quite controlled. Not a lot like before lah. Number 2 is common cold. Okay, common cold. Okay, influenza. We have something we call influenza. Influenza. The symptoms is the symptoms is about respiratory tract infection lah. So you have very high grade fever, cough, runny nose, very bad one, influenza. Okay. The other one is TB, tuberculosis. Okay, tuberculosis mainly affect the respiratory tract. I'm the one in charge of TB in UIA. Not a lot of cases. Before we have a few cases lah. Okay, TB, tuberculosis. Main infection site is a respiratory tract. Okay, but this TB usually will cause manifest as prolonged cough, usually more than 2 weeks. You know, prolonged cough, loss of weight, loss of appetite. Okay, this is what we call TB, and TB also can infect other system. For example, lymph nodes. It can affect the brains, can affect the intestine, can affect the ovary. But the main when we're talking about TB is lung, respiratory tract. We have also chicken pox, quite common in Gombak, and also we have mumps, beguk mumps. Okay, vector-borne. Number 2 is vector-borne, mosquito lah, usually mosquito. Common one in UIA is dengue fever. Okay, dengue fever, we have 2 types of dengue fever basically. Okay, dengue fever we have 2 types. Dengue fever. Number 2 is dengue hemorrhagic. Maksudnya demam dengue biasa dan juga demam dengue berdarah. Demam dengue berdarah ni bahaya. Okay. Like before we have cases in Zuhdi, Mahala Zuhdi. We have students infected by dengue fever lah. Okay. So most of them dengue fever, not dengue berdarah lah. Okay. What is the difference between dengue fever and dengue berdarah? Okay. Dengue fever usually just fever only, fever. Like body pain, muscle pain, just like that. But dengue berdarah, dengue hemorrhagic, okay, dengue berdarah ni, there is a warning, okay, warning sign. For example, vomiting, tak boleh makan, tak boleh minum, diarrhea teruk, altered mental status and so on. This is more dangerous one. Number 3 is malaria. Malaria quite rare lah. Malaria I have never seen, but except student if coming back from high risk place, like for example Africa. Malaysia we have also malaria. So what is common between dengue fever and malaria? The manifestation fever is more or less the same lah. Okay, high grade fever. Alright. Number 3, contagious skin. This one quite common as well in Gombak campus. Fungal infection, herpes. I will show some picture after this. Okay, scabies, HFMD, hand, foot, mouth disease. Okay, and we have sexual transmitted disease also in Gombak. That's quite disappointed lah, because we have I have experience lah seeing student infected with HIV. Yalah, kita nak expose kat sini pun, I don't want to get into details, but we have cases. Unfortunately, we have HIV, we have also hepatitis B, hepatitis C, syphilis, gonorrhea, and this one is sexual transmitted disease, and also can be transmitted by bloodborne. Okay, so that's unfortunately what happened in our society lah. Okay, number 5 is personal contact. For example, touch. If for example the patient have conjunctivitis ni mata merah, dia just mata merah, dia sakit mata, biasa Malaysian refer as sakit mata, kan? That one usually macam mana dia berebak, how it get infected? By touch. For example, I have the conjunctivitis without any other symptom. I don't have fever, I don't have like coughing, I don't have runny nose, I just red eye only. How it get infected? I can stay close to the patient without being infected. So how is I'm going to be infected by this patient? If the patient touch the eye without tissue, or just direct with bare hand, and then he touch doorknob, for example, and touch other surface, and then I touch the doorknob, tombol pintu tu, and then I touch back my eye. So that's how it get infected lah, conjunctivitis. And number 6 is contaminated food poisoning. This is, as I said, this is cases that It's not usually. This presented in our community in Gombak campus especially. Next slide please. Ada berapa minit lagi ni? How many minutes already left? Brother Omar?
Around 3.
3 minutes. Tak sempat. 3 minutes. Okay, go very fast. Alright, this is airborne. Okay, this is airborne. Okay, that means the patient coughing, batuk batuk, sneezing and so on. Okay, the germs fly on the air lah. Okay, next slide. Now this is how far, this one I want to, how far the droplet, dia punya kuman size of particle droplet tu can fall. Let's say I breathing, right? So I breathe. Okay, there is study how far it can move. The study show that what we call, if the droplets evaporate and fall, it can fall up to 2 meters. But if the patient sneezing, laju kan, sneezing very fast, right? Can go up to 6 meter. If coughing, 4 meter. If just normal breathing, 1 to 2 meters lah. So it will get worse if the what we call the environment is closed, poor ventilation lah. Alright, next. This is TB lah. This is disease that in fact what we call spreading by airborne and so droplet. COVID, influenza, common cold. This is quite common. Common. Next. This is TB. TB, you need to know TB biasanya long symptom, more than 2 weeks. Patient sometimes batuk, coughing more than dekat 1 month baru datang klinik. This is unfortunate lah. So if you have coughing, prolonged cough, loss of weight, this one we need to do X-ray lah. Okay, don't delay the treatment. Get early medical consultation. Okay, don't after 1 month, 2 months, doktor saya dah batuk dah sebulan dah doktor, just dia rasa macam batuk biasa. I think this is just normal cough. I have one patient, she said that I have asthma, so this is quite common for me to have a cough. The cough around more than 1 month. So when we do X-ray and we check the sputum, this is confirmed TB. So this is different disease and we need to different what we call special treatment lah. Okay, next. Okay, this is chickenpox lah. Chickenpox, macam mana dia infected? This is quite common also in our community. Droplet. And also if you touch the skin of the patient, especially bila ada blister, still ada blister tu. Kalau dah crusted, macam dah ada kuping tu okay. Kalau still ada blister, looks like watery inside, that one is the infectious contagious period lah for the chickenpox. Next. This is mumps lah, beguk This one merebak melalui apa? Spreading through droplets. If you get near to the patient, coughing lah. Okay, next, laju sikit lah tak sempat nak discuss. This is dengue fever lah. Dengue fever, high grade fever, body pain. This one can be dengue, as I said to you, or dengue hemorrhagic. Dengue hemorrhagic can kill you. This one is not something you can take lightly. If high grade fever, you need to come to clinic early. We need to do blood test lah. Then dengue sometimes can be what we call overlap with upper respiratory tract infection. For example, they have fever and also they have sore throat and also some mild cough. This one also can be dengue. So this one, please come early. Jangan 3-4 hari, 3-4 days you got fever and then delay treatment lah. Because dengue will kill you, can kill you if you're not treated early. Okay? But the treatment actually, if just dengue fever, we just give paracetamol only lah, and also hydration lah. But dengue hemorrhagic, dengue berdarah, that one is different story. This is we need to refer to hospital. Next. Okay, contagious skin disease. Ini tak sempat I nak cerita. This is quite common, shingle, kayap. Okay, next. Kita tunjuk gambar lah. We just show picture. Shingles. This is kayap. This is called kayap. In Malaysia we call kayap lah, shingles. This one very infectious. Very painful and very very contagious. Next. This is scabies, kubis buta. This one very infectious. This one sangat infectious, kubis buta. This is parasite. Ni quite common. Usually dekat celah-celah jari, cleft of your fingers, toes. Very itchy. That one you need to come. Next. Herpes. This one virus infection. It can be transmitted by touch. Okay, touch dia akan dia macam blister lah. I cannot explain quite detail because of time limitation. Next is fungal infection. This one fungal infection. So you tak boleh lah share the what we call clothes, towel with other what we call your friends. This one is risk. What we call this one risk for transmission of the disease. This is fungal infection. In Malay we call kurap lah. In Malay language we call kurap. Okay. Sekejap. Okay. Okay. Okay, HFMD. This one HFMD lah, hand foot mouth disease. Okay, next. This one very infectious. This one sexual transmitted disease. As I told you, sexual transmitted disease is quite common. It's not quite common. Unfortunately, we have HIV. Unfortunately lah. Real patient lah. I pernah dapat satu patient presented with anal wart. Dia macam ketuat dekat anus. At first he said this is dia kata 𝑺𝒕𝒓𝒆𝒏 hemorrhoids. So when I examine, this is anal wart. Anal wart memang sexual intercourse lah. Sorry to say. So I have also one patient, student HIV. Unfortunately HIV. So yeah, hepatitis C, gonorrhea. We have discharge from you punya penal. Sorry, I need to say the word. The penal, what we call discharge. The one gonorrhea. Okay, syphilis. Alright, next. This is conjunctivitis lah. This one conjunctivitis. Alright, and this one is food poisoning. Alright, this is a brief introduction because of time limitation. So, alright, maybe in Q&A lah if you have any question. So I back to Brother Muhammad Umar.
Thank you, Doctor, for the explanation. So before we proceed, I would like to highlight few important things that has been mentioned. The first one is we know about infectious disease, and the opposite of it is non-communicable disease, and how it is transmitted via few channels. And also we know about incubation disease and contagious period, a period that we have to aware. And the next one is type of infection diseases, as been explained before, such as airborne, vector-borne, contagious STD, etc., etc. And Doctor has also showed us a few pictures of symptoms in case, na'udzubillah min dhalik, we are infected. So we shall know the early symptoms so that we can be treated well. So inshallah, we proceed to the next round. Question to Dr. Noor. Dr. Noor, are there other factors that make one susceptible to infectious diseases? The floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much to the QUSSA team, Dr. Raudha, Dr. Sofia, Mr. Moderator and the team. Thank you very much. Saya datang malam ini untuk berkongsi dengan anak-anak sekalian as also a fellow of Mahallah, yang saya juga pernah lihat beberapa situasi yang seperti Dr. Zuhdi katakan tadi. So the talk tonight will be in dual language, would be in sedikit-sedikit dalam bahasa Melayu and would be selebihnya juga dalam bahasa Inggeris. Right, next slide please. Now, what I would like to touch is actually impact of lifestyle on the immune system. Now, first and foremost, kita kena faham sakit itu datang daripada Allah, penyembuhan juga datang daripada Allah. Semua berlaku dengan izin Allah. Tapi, we as human, kita sebagai manusia, kita kena ada ikhtiar untuk mengelakkan daripada segala penyakit ni. Kita sakit sebab antaranya ialah immune system kita. Immune system kita ni dia macam orkestra dalam badan yang melindungi kita. Allah dah jadikan asbab ni sebagai internal mechanism kita. So kita ada T cells, white blood cells, semua dia ni lah yang akan pegang shield, yang akan berlawan dengan segala patogen ataupun microorganism daripada luar ni. Jadi kalau immune system kita tak kuat, maka boleh jadi kita sakit. Kalau immune system kita kuat, dia lawan-lawan, boleh jadi kita tak dapat sakit tu. So now apa yang saya nak cakap ialah macam mana lifestyle kita ni boleh impact kepada immune system kita. Right, next slide please. Now what is lifestyle? Okay, in recent past decade, lifestyle has been interesting for many people with different levels of literacy and academic education. So lifestyle is actually a way or style of people living in a special time and place. Lifestyle includes behavior and functions of individual and is formed in specific geographical, economic, political, cultural, and religious contexts and influenced by them. Lifestyle is an important and effective agent influences different aspects of human life. Human thoughts, perspective, practices affect the body and soul via lifestyle directly or indirectly. Next slide. Bila kita cakap pasal lifestyle, now kita sebagai orang Islam, kita nak tekankan apa itu Islamic lifestyle dan apa yang Islam dah gariskan dalam lifestyle ini. Now, in the Islamic lifestyle, many recommendations have beneficial effects on human health. Islamic lifestyle influence human immunity with comprehensive recommendations and rules for different stages of life from the beginning until death. Macam mana? Saya akan buktikan. Next slide. Ini tak ada apa-apa, saya hanya present apa yang telah Allah takdirkan. Benda ni dah ada. We are not knowing anything new. Everything comes from Allah. It's just that kita baru discover saja benda ni. Now talking about immune system, kita nak tahu juga kan, kita dapat immune system, ketahanan badan ni daripada mana? Now saya cerita sikit sejarah atau asal usul sedikit daripada immune system ni. Now the immune system evolves from the immature and developing immune response in infant and children through the potentially optimal immune functions in adolescents and young adult. Macam kamu sekarang ni dah fully function lah kamu punya immune system. So followed by a gradual decline in immunity. Nanti bila kita dah tua esok ni, immune system jadi lemah balik. Right? So age-related changes in the immune system are combined by certain lifestyle factors. Contohnya diet, environmental factors, oxidative stress yang kita hadapi yang kita tak sedar tu. So specific to each life stage that can influence and modify and in some cases suppress immune function. Jadi benda-benda ni semua boleh membuatkan immune system kita kuat atau lemah. The lifestyle. So immune protection against pathogen immediately after birth relies on passive immunity and innate immunity. Dulu masa kita lepas saja dilahirkan, kita punya immunity ni, kita punya immune system ni yang ada dalam badan baby kita dulu tu diperkuatkan lagi dengan ibu kita. Melalui macam mana? Breastfeeding. Breastfeeding plays a key role in infant passive immunity and is affected by human lifestyle, particularly the mother's diet, spiritual condition of the mother tu, and lack of stress. Ini sangat-sangat penting untuk menghasilkan susu. Now, mammal milk not only in the main source of newborn nutrients, but also contains many distinct bioactive molecules that protect the offspring, kita lah, anak lah, against infection and contribute to immune maturation, organ development and healthy microbial colonization. Ini asal usul immune system kita daripada kita dapat kecil-kecil dulu. Susu ibu tu. Maka beruntunglah kita apabila disusukan oleh ibu hatta ibu kita atau ibu susuan. Maka pentingnya Allah mensyariatkan itu sebab ada kelebihan dan kepentingan dia. Kita pergi satu-satu Kita tengok dekat sini, the impact of some age-related Islamic lifestyle factors on human immune function. Number 1, when a baby gets complete breastfeeding, tambah pula bila ibu yang menyusu tu membaca ayat-ayat Al-Quran, membuat doa ataupun membaca apa-apa doa while breastfeeding tu, apa yang anak tu dapat? Dia dapat infant passive immunity. Number 2, beneficial effects via neuroimmunoendocrine network. Network dia ni kuat. I will not go into the science of it. Ini Islam kata, Islam cakap kan, Allah cakap pasal breastfeeding kan dalam Al-Quran kan. Ini yang kita dapat. Ni yang kita nak tengok Islamic lifestyle ni. Right, number 2, eating halal food and not eating haram food. Allah kata makanlah daripada makan yang halal. Jauhilah makanan yang haram. Ada yang setengah tak faham, ada yang setengah faham, buat-buat tak faham. So apa yang kita dapat dengan suruhan Allah ni? Normal nutrition and prevention of obesity. Kalau kita betul-betul makan makanan yang halal dan thayyib. Nutritional disorders pun tak ada. And therefore prevention from infection, development and transmission. Makan real food, makan whole food, bukan junk food. Bukan all those McDonald's, KFC yang kita boycott semua kan, Alhamdulillah. Sekarang kita shift kepada Mary Brown pula. Sama je. It's still junk food. So fikir-fikir kan. Okay, nanti saya akan beritahu tentang halal dan thayyib tu. Next slide please. Now number 3. Washing some parts of the body. Allah kata sebelum solat wudu. Allah kata nak mandi wajib itu buatlah ghusul. So apa hikmah daripada situ? Now with this, subhanallah, infectious disease control and prevention. Kenapa orang Islam ambil wuduk 5 kali sehari untuk 5 waktu solat dia? Kalau nak ikutlah, orang Islam kita paling bersih. Tapi kajian menunjukkan orang Islam kita antara ataupun paling kotor. Negara-negara Islam itulah yang paling kotor bila kita nampak bandar-bandar je bersih. Nah, kita tanya balik, bukankah kebersihan itu yang paling utama sekali Islam titik beratkan? Macam mana pengamalan kita? Macam mana kita ambil wuduk? Ya, ulama-ulama terdahulu kalau demam ambil wuduk sihat. Kita ambil wuduk tak sihat-sihat. Macam mana kita melazimi wuduk kita? Tak ada emosi, tak ada jiwa, tak ada roh dalam wuduk kita. Nombor 4, fasting. Kita dah nak datang bulan Ramadan dah. Allah suruh puasa. Tak lama pun bulan Ramadan saja. Kalau mampu buat puasa-puasa sunat. Apa kelebihan Islamic lifestyle ni? Enhance the T cells functions in the presence of antigens or mitogens, interleukin 2, interleukin 3. Nak apa nama lagi? Saya boleh letak semua. Interferon gamma. Semua tu short form kat situ. Dengan berpuasa dapat meningkatkan segala immune sistem tubuh, mengurangkan kolesterol dan dapat menguatkan segala network dalam badan kita balik. Dia dapat pulihkan. Daripada lahir sampai sekarang kita ni makan tak berhenti. Kalau tak ada Ramadan, agaknya perut dan sebagainya tak dapatlah rehat. Innalillah, perut kata, aku asyik berkunyah je, aku asyik function je. Next slide. Number 5, surgical removal of the foreskin. Bersunat untuk anak lelaki dan anak perempuan. That is Islamic lifestyle. Macam orang kata pasal bersunat ni barbaric this and that. Tapi subhanallah, the truth is decrease risk of sexually transmitted disease, protection against penile, cancer, and reduction the risk of cervical cancer as well. Prevention of balanitis, balanopostitis, ini semua Dr. Zuhdi mungkin lebih tahu. Pasti. Dan number 6, forbidden use of alcohol beverage. Allah kata alkohol tu haram. Walau sedikit haram, banyak pun haram lah. Ya. Kebaikan dia sangat banyak dekat sini. Prevention of negative effects of alcohol. Minum alkohol mabuk. Apa tanda mabuk? Dia akan ganggu kita punya immune system. So semua NK cell dysfunction, decrease number of natural killer cells. Bukan kita nak increase number of killer cells yang nak bunuh benda lain tu. Rupa-rupanya sel tu yang semakin menurun. Macam mana kita nak kuat? Macam mana kita nak hindari diri daripada infectious disease? Right. Next slide. Okay. Now, bila saya cakap pasal ini, bila kita cakap pasal anak-anak di mahalah kita, saya nak tekankan satu perkara. Satu perkara di mana tentang pemakanan. Sebenarnya melalui pemakanan, kita boleh menguatkan immune system kita. Dan melalui pemakanan juga, dia boleh menjahannamkan immune system kita. Lemah aja manjang. Lepas tu adalah penyakit-penyakit lain yang datang. Ya, sebab bertitik tolak daripada pemikiran kita, daripada pemakanan yang tidak sihat dan sebagainya. Now, there is an essential relationship between nutrition and body competence against infection. Many studies suggest that dietary intake affects infection risk via an impact on immune functions and on other effects. Okay, next slide please. Right, kita cakap pasal nutrition. Some important nutritional situations with potential effects on immune function, effects by lifestyle, will be discussed after this. Okay, nutrition satu has essential effects on human health and prevention and control and treatment of different diseases. It is directly or indirectly influenced by lifestyle, and there are clear relationship among nutrition, infection and immunity. Now, changes in one component affect the others. Kamu tukar pemakanan kamu, benda lain dalam badan akan berubah, akan terganggu. Jadi kalau kamu improve pemakanan kamu, semuanya akan berubah menjadi baik. Tapi kalau kamu mengamalkan pemakanan yang tak sihat, tak tahu pilih makanan, sengaja pilih makanan-makanan segera yang merosakkan badan yang menjadi amanah daripada Allah yang kita pinjam ni, maka semua benda akan berubah sebaliknya. Dia tak berubah semakin bagus. Ya. Next slide please. Okey, dekat sini bila kita cakap pasal pemakanan, dia ada 4 situasi pemakanan yang akan affect kita punya immune response. 1, apabila kita berada dalam food poverty. Kita alhamdulillah di Malaysia, kita bukan di Gaza. Kita tak pernah rasa pun tak ada makanan macam orang di Gaza. Semiskin-miskin kita pun tak semiskin orang sana. Percayalah, sehari makan sekali pun kita masih tak mati, kita hidup. Tapi orang Gaza, kita tak tahu berapa hari mereka tak makan. Satu video yang saya tengok, ada video dia tunjukkan budak-budak Palestin, ada seorang wartawan tanya, adik, apakah kamu ingin katakan pada orang di luar sana? Apa agaknya yang kamu nak teringin? Makan ke, nak buat apa-apa ke? Dia kata pada wartawan tu, budak kecil ni, dia kata, Encik, ada tak satu makanan yang saya boleh makan sekali, saya boleh kenyang seumur hidup? Dan dengan titisan air mata. Dia minta macam tu sebab dia kata apa? Dia sambung lagi. Subhanallah, saya dengar memang menitik air mata. Dia kata, kami nak makan roti, kami cari serbuk-serbuk roti daripada lantai. Orang lain buang roti. Kami nak makan benda tak ada. Kami ambil rumput, buat kunyah-kunyah. Tapi orang lain buang makanan. Boleh tak bagi dekat kami? Boleh tak buat satu makanan yang boleh bagi kami kenyang selama-lamanya? Sampai kami jumpa Allah. Subhanallah, siapa nak tolong budak-budak ni Apa yang kita buat dekat Malaysia? Beli sini sana membazir, tambah ke bila datang bazar Ramadan ni? Beli masa ikut nafsu tapi kita tak tahu apa yang terjadi. So food poverty, bila kita bayangkan in some certain places di Filipina dan sebagainya, sangat susah mereka untuk mencari makanan. Mereka bahkan mencari makanan di pusat-pusat, the dump area, bawa balik, basuh makanan tu, masak balik. Lepas tu jual balik. Kalau kamu pergi ke YouTube, kamu cari PAG in Philippines. Kamu tahulah macam mana diorang hidup. They live in a slump area. Now, number 2, pasal makanan juga. Ini overeating and obesity. Dan tahniah kepada orang Malaysia, kita antara yang tertinggi obesity. Sesuatu yang tidak boleh kita banggakan. Ada yang satu ni tak ada makanan langsung. Yang ada yang satu kita ni overeating. Biasa masa muda-muda banyak aktiviti kita makan 2 pinggan. Bila kita dah berumur, kita makan 2 pinggan juga. Walhal output kita, gerak kerja kita dah tak macam dulu. Duduk sahaja. Kita bukan pekerja kontrak yang memerlukan makan nasi lemak siang malam pun tak apa. Tapi kita pelajar, kita guru, kita duduk banyak lebih daripada berdiri dan berjalan. Jadi input kita pastikan kena sama dengan output. Jadi obesity terlebih pun dia akan ganggu immune system, tak cukup makan pun dia akan ganggu immune system. Now specific nutritional needs dekat sini bila kata specific nutritional needs ni, kita akan tengok beberapa situasi yang mana dia berpenyakit dan penyakit itu disebabkan oleh beberapa faktor yang kurang. Jadi setengah orang memerlukan setengah zat yang lebih daripada orang biasa. Now, last but not least, eating habits and dietary pattern. Okay, now this eating habits and dietary pattern ni, it's upon choice. Kamu boleh memilih. Kamu boleh memilih makanan yang baik, kamu boleh memilih makanan yang halal, kamu boleh memilih makanan yang tidak mahal tetapi masih sihat. Tetapi banyak di antara pilihan-pilihan student bila call grab dan sebagainya, dia pilih makanan yang dia teringin. Bila happy, kajian menunjukkan kita boleh buat pilihan makanan 2 jenis. Satu, bila happy kita nak makanan-makanan tak sihat. Dan bila kita happy, kalau kita biasa makan makanan sihat, kita akan ambil makanan sihat. Tapi bila kita tak happy, kita akan selalu rasa nak makan makanan yang tak sihat tu lebih. Once bila kita makan makanan tak sihat tu, kita punya brain akan beritahu apa? Nak lagi, nak lagi, nak lagi. Indirectly dah ada ketagihan kat sini. Nak berhenti susah. Samalah ketagihan apa-apa jua. So, nak halal, jiwa mesti kental. Buat pilihan yang baik, buat pilihan yang bijak. Alright, I think that is all. Ya, setakat ini sahaja for the first round. Nanti kita tengok input daripada Dr. Zuhdi lagi dan nanti kita akan sambung lagi penyampaian saya di sebelum di akhir tu.
Jazakumullah khairan, Doctor, for the sharing. So as usual, I would like to conclude a few highlights from this round. That is how our lifestyle impact our immune system. And as been mentioned by Doctor, the Islamic way of life have been helping us to keep our immune system in the best condition, such as complete breastfeeding. That's why Islam encourages its people to complete their breastfeeding, and also eating halal food. And as I'm been minoring in psychology, our lecturer has also discussed in class about how eating halal food also will impact our psychology. And the third one is watching some parts of the body, as we also learn wudu and also fasting, surgical removal of the foreskin, and also forbidden alcohol. So I guess that is the main highlight for this round. So moving on to the second round, coming back to Dr. Zuhdi. For the second round, what are the methods to avoid ourselves from being infected by those diseases?
Okay. Okay, thank you Brother Muhammad Omar. Terima kasih Brother Muhammad Omar. Dr. Noor Yuslida, very nice. I think saya sangat tertarik dengan point Dr. Noor tadi berkaitan dengan pemakanan. That is one of my favorite topic actually. And also fasting. Fasting, for example, intermittent fasting, Islamic intermittent fasting is one very good. And just respon sikit pada Dr. Noor punya point tadi. Obesity, we talking about obesity. Kita tengok, kalau kita tengok COVID case, if once infected by COVID and he has obesity, he has a high risk. High risk maksudnya dia punya COVID tu akan getting worse. Okay, so very good lah. That means in terms of lifestyle, in terms of nutrition, how you want to build your, we call innate immunity. This one very good. Thank you, Dr. Noor, for highlighting this. Okay, back to the question by Brother Muhammad Umar. Okay, first slide. Yeah. Back lagi slide. Dia dah tengah-tengah tu. Oh, kenapa dia? Sekejap belum. Tu yang apa yang next lagi. Yang after yang last yang saya stop tadi tu. This one. Yang tips to prevent tu. Tips to prevent. Okay, tips to prevent infectious disease. Macam mana kita, apakah cara kita nak buat untuk prevent ataupun kita nak elakkan daripada terkena jangkitan, ikhtiar kita lah. Okay, first one is personal self hygiene. Environment hygiene, maksudnya kebersihan diri sendiri dan juga kebersihan persekitaran. This one the basic one lah. How you take care of your what we call of your hygiene lah. Okay, mandi lah, at least mandi lah kan. Ada kadang-kadang student datang klinik ada yang tak mandi. Maaf, sorry to say lah, ada yang tak mandi tau, bau kadang-kadang kan. So maksud mana, this is a basic one lah. If basic one mandi pun tak, macam mana kan. This is a very basic one. Personal self hygiene and also environment hygiene, kesihatan. Number 2 is avoid close contact with symptomatic patient. Kalau you ada kawan-kawan batuk, fever and so on, try to avoid. Bukanlah avoid, maksudnya at least keep distance. Okay, because we don't know what type of germ dia tengah ada kuman apa kat dalam badan dia tu kan. Okay, and then advise your friends lah, janganlah kita abaikan dia, ignore dia kan. Then advise, brother, I think you should go to clinic lah, check. Okay, early treatment is very important. Okay, number 3 is avoid sharing things. Kan, jangan pergi share pula power lah macam saya kata tadi kan, especially condition yang melibatkan contagious skin disease. Macam contoh yang I highlight tadi kan, macam fungal infection, chicken pox for example kan, herpes, okay, scabies, kudis buta, that one is easily infect other people. And also razor, pisau cukur, janganlah share pisau cukur sebab that one is can cause bloodborne infection. Bloodborne ni contoh apa? Hepatitis kan, hepatitis B, hepatitis C, alright, HIV, even HIV. So try to avoid simple things like sharing personal items like this. Number 4, okay. Number 4 is wash your hand. Basuh tangan. This one very important. Amalkan basuh tangan at least 20 second. Okay, boleh share tak video satu ni nak cerita sikit berkaitan dengan wash hand ni. Minta organizer share sikit some short video lah. Actually you can Google in the YouTube. How to wash your hand. Kan? Kadang kita ingat basuh tangan macam tu je kan.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly.
Okay, boleh stop video Alright, okay. So basuh tangan. So bila kita nak basuh tangan? Contohnya kalau kita coughing, contohnya batuk kan, batuk, sneezing, ataupun you ada contact dengan patient ataupun you ada contohnya ada patient kawan, your friend ada symptom, you bersalam dengan dia. So that's the you kena wash your hand lah, basuh tangan. Sama ada kalau tak ada sabun, you pakai sanitizer lah. Okay, this one wash hand very important. This one satu cara untuk kita elakkan jangkitan infectious disease. Okay, number 5 is good ventilation, pengudaraan yang baik lah. Okay, kalau dalam bilik tu buka lah sikit tingkap tu kan, ventilation. So kalau you ada dekat mahalah kan, ada 4 cubicle, right? So kalau ada patient yang ada coughing and so on, ada kawan-kawan yang menyebarkan, spreading the germs through the airborne, at least kalau you ada good ventilation, it will what we call less harm lah, less risk for you to get infected. Okay, number 6, vaccination lah. Okay, vaccination is some controversial topic, tapi ialah kita panggil arus perdana ni. So we are promoting vaccination especially for COVID, influenza usually yearly lah, especially for high risk patient. Contoh high risk patient macam mana? Contoh high risk patient contohnya macam we all lah as a medical staff yang selalu deal dengan patient. Number 2 is old age patient. Number 3 is patient yang ada banyak medical problem, diabetes, hypertension, obesity, alright, cancer patient, that one high risk patient. So vaccination actually apa dia punya what we call the idea of vaccination. Okay, actually for immunity we have 2 types as Dr. Noor mentioned just now. Innate immunity. Innate immunity ni maksudnya natural immunity. For example, kita ada macrophages, kita ada neutrophils, sel darah putih. Itu yang innate. Okay. Vaccination ni pula dia nak develop special force, komando. Kita ada askar lah, soldier, kita ada askar biasa, kita ada komando, special force. Okay, so the idea is kita exposekan kuman tu sedikit, maksudnya kita lemahkan kuman tu. Okay, kita masukkan ke dalam badan so that our immune system kita dah terus train untuk kenal kuman tu. So next time kalau betul-betul kita expose to the real germs, so body kita dah get ready. Okay, that's the idea of vaccination lah. Alright, next. That one vaccination cause that one kita panggil yang itu innate immunity kan. This one kita panggil cell adaptive immunity. Alright, Sejahtera ni kita ada banyak lah. Kita ada apa? T lymphocyte for example. Okay. Special type of kita panggil special force sel darah putih lah. Okay, number 7, macam mana kita nak avoid jangkitan, especially yang berkaitan dengan droplets. Droplets ni macam batuk kan, daripada titisan droplet ILO tu. So mask very important. So mask actually ada two types of mask. Kita punya ni lah mask. So sekarang ni kalau saya tengok, kalau student datang, ada some students bila datang klinik coughing dan so on tak pakai mask. Masuk klinik tak pakai mask. Dia tak ada, dia rasa macam dia tak ada common sense. Macam that's why I mentioned earlier macam mana Islam ajar kita supaya kita tak harm other people. Kan? Kita tak harm ourselves, kita tak harm other people. That's very important. So bila you ada coughing, you move around, you duduk dekat orang lain, and you rasa tak bersalah pun nak infect other people. Kan, this is disappointed lah, little bit disappointed lah. So mask basically ada 2 type. So dia panggil nama 1 kita panggil non-medical mask. Okay, yang kedua kita panggil medical mask. Apa beza dia? Okay, dia ada 3 layer juga, ada close mask. Cuma dia punya medical mask ni actually especially kita guna kat klinik tu lah. Dia panggil medical mask. Dia ada tulis medical mask. Dia punya material dia pun lain lah. So basically medical mask ni nak pakai untuk siapa? Contohnya untuk public. Public tu kes macam mana? Untuk old age contohnya, more than 60 years old, yang ada banyak penyakit, yang terpaksa duduk tempat crowd, contoh dia nak pergi ke bank ke, kan, dia nak pergi tempat-tempat yang ada ramai orang tapi dia ada banyak penyakit, dia old age. So kenapa? Sebab kita nak kurangkan risiko, especially kuman-kuman airborne dan sebagainya, droplet dan sebagainya. Okay, medical mask. Number 2 untuk patient, memang patient, contoh COVID, memang dia dah ada COVID, kena pakai mask lah. So medical mask, we encourage to wear medical mask if affordable lah. Number 3 is caretaker of the patient. Okay, maksudnya you ada satu patient, contohnya ibu dia ada anak yang ada COVID, so dia kena pakai medical mask, maksudnya medical grade lah. Non-medical mask ni, dia sama juga, dia ada 3 layer. Next slide please. Ini contoh ini daripada website Sirim saya ambil Kita ada 2 type. Yang sebelah kiri tu, sorry, dalam website Sirim dia ada chalk Sirim, dia ada barcode daripada Sirim. Okay, that one is non-medical. That one pun dia ada chalk Sirim. This one non-medical mask. So non-medical mask untuk macam mana? Contoh macam kita lah. Contoh kita nak pergi tempat-tempat yang crowd, yang kita young age kan, risk factor is less. So contoh you nak naik public transport ke, you risau get infected dan sebagainya, so you can wear non-medical mask. Alright, so kalau yang bagus ni ada lambang Sirim ni lah, you got the logo Sirim logo lah. Next, yang ini medical mask. Ni medical mask, dia tulis medical surgical mask. This one medical standard lah. Alright, next, yang banyak saya tengok lagi common mistake yang ni, how to wear mask. Banyak orang pakai mask tak betul. Okay, so macam mana kita nak tahu cara yang betul pakai mask? Nombor 1 is, kalau mask tu, kita tengok kan dia punya design dia ada yang ada color, yang dia ada side yang color dia agak faint sikit, dia agak light sikit. So yang kat depan ni ada color, macam contoh warna biru kan, brighter color as outside. Okay, kalau you tengok dia punya window dia tu kan, dia kan ada tingkat-tingkat macam sisit tu kan. Kalau dekat dalam tu dia punya sisit, dia punya window dia ke atas. So bila you pakai ke dalam macam tu, maksudnya ILO you akan accumulate dekat kawasan tingkap dia tu, window dia tu. Okay, and then macam mana you nak decide atas bawah? Atas tu dia ada macam apa, keras sikit lah, hard sikit. So at least then you can cover your nose and you boleh tekan sikit lah macam tu. Okay, so this is yang contoh yang sebelah kanan ni adalah cara-cara yang tak betul pakai mask lah. Around your neck kan, kat forehead kan, under your nose, tak tutup pun nose. Kita nak tutup nose ni dengan kita punya mouth kan, on your chin, pakai kat chin kan. Kan, lepas tu kita tak cover, kita tak meet the purpose lah. Kita nak cover nose dengan mouth. Okay, tu macam mana. Satu lagi cara yang silap pakai adalah bila you dah pakai, okay, basically you tak boleh sentuh lah kat tempat yang dia punya kain tu, you tak boleh sentuh. Kalau you sentuh, you kena wash your hand. Okay, yang bagusnya yang pakai buang lah, the best is pakai buang. So after you guna, you kena letak kat tempat yang jangan buang rata-rata kan, just throw everywhere like this. Kena buang ke tempat yang sepatutnya lah. Okay, next. Yang ke-8, macam mana cara kita nak elakkan jangkitan adalah cough etika batuk. Okay, yang ni saya nak kena buka video. Video yang kedua. Organizer please. This is cough etik, etika batuk. Batuk pun kena ada etika juga. Right? Atau kalau tak begitu, sebab dekat dengan laju. Then buang lah, curi. And then go through. Etika lah. Ni tengok tu lah. Ni lah buang how to pick your hand. Then terus sanitizer atau wash hand. Jadi setiap kali kena wash hand. Wash hand macam saya ajar tadi lah. Okay? Alright, thank you. Okay, itu etika batuk, cough etik. Alright, sambung balik tadi, saya dah habiskan. This is etika batuk lah. The next slide tadi. Okay, yang ini infectious disease, as I told you, this is very big topic, so banyak benda nak cover. So this one nyamuk lah, this one quite common. This one very very important. Dekat UIA kita ada kombi untuk dengue kan, macam mana how to prevent vector, nyamuk tu lah. Okay, kita remove mosquito habitats, tempat-tempat air bertakung kan, gunakan ubat nyamuk kan, pakai lengan panjang, baju lengan panjang guna nets kita buat bersih kawasan dan sebagainya kan, dan juga light up your home and use air conditioning, sebabnya nyamuk ni dia suka tempat gelap, dia suka tempat yang gelap. Okay, next. Vector-borne ni usually yang famous dekat UIA dekat Malaysia ni dengue lah. Precaution when travelling to high risk place. Maksudnya kalau kita nak travel ke high risk place, contoh nak pergi ke negara-negara Afrika contohnya, kat situ kan banyak malaria dan sebagainya kan. Ataupun you nak travel pergi ke kampung-kampung kat Malaysia ni, nak pergi kawasan-kawasan hutan, waterfall dan sebagainya, get advice first. Okay, kita nak kena check dengan pejabat kesihatan daerah dulu, high risk places, contohnya tempat tu ada malaria ke kan, ada tempat tu memang ada dengue, nak pergi tempat kampung orang asli dan sebagainya, make sure kita dah kena thinking of vector punya ni, vector risk ni, vector borne punya disease, dengue, malaria, kencing tikus, leptospirosis. Nah, ini benda-benda yang common lah. You nak pergi air terjun dan sebagainya kan. Sebab malaria ni, okey ada 1-2 minit lagi. Okey. Malaria ni kalau contoh ada tempat-tempat kawasan hutan dan sebagainya yang high risk untuk malaria, kita kena bagi ubat untuk prophylaxis lah. Doxycycline nama dia. Okay, next. Dah kena warning dah ni. Okay, prevention STD, sexual transmitted disease, very big topic. Sexual transmitted disease, related tak? Relevant tak saya share kat sini? Memang sangat relevant tuan-tuan. Memang saya sangat sedih. Saya nak cerita pasal HIV, hepatitis. Saya tengok dalam statistik pun sangat-sangat sedih lah. Sangat-sangat menyedihkan. It's real lah, happen in our university lah. Alright, so safe sexual, safe, but is the most important is halal one lah. Okay, safe tu penting lah kan, pakai sorry to say lah, kondom, protection dan sebagainya, tapi make sure halal. Lebih important is halal. You safe tapi you buat zina dan sebagainya, that's what pun prohibited in our what we call in our religion kan. So avoid illegal activity, IV drug abuse, this one tak banyak sangat kot. Tak ada kot dekat dalam UIA ni. Tak pernah jumpa lagi IV. Kalau sekadar ambil macam ganja semua tu adalah. Okay, unsafe blood related treatment. Unsafe related treatment contohnya apa tuan-tuan? Contohnya macam bekam contohnya. Bekam. Bekam ni risiko juga, especially kalau you are sharing, you are doing with a non-qualified practitioner. Saya pun buat bekam. I also train cupping therapy bekam. Saya cuma you kena pilih practitioner yang hygiene lah, yang hygiene. Sebab apa, you sometimes dia akan gunakan the same cups. Okay, how they wash Kan? You bayangkan sebelum you buat cupping tu, practitioner tu buat dekat satu patient HIV, patient hepatitis kan. Dia basuh-basuh cup tu lebih kurang, dia buat kat you. You nak ke tak? That's why. Kan? So cupping terapi, yes, hijamah is sunnah, tapi hygiene is also one of the sunnah yang kita terlupa lah. Okay, next. Okay, most common, next satu lagi, next slide please. Prevention of food poisoning. Food poisoning ni memang you tahu lah kan macam mana basuh tangan. Sebab food poisoning sometimes dia operator dependent juga, bergantung kepada the one that prepare the food lah. So, untuk your side, wash your hand. Also, then juga kalau ada makanan yang expired dan sebagainya, you kena hidu dulu bau tu. Bau you tengok lain macam, dah ada kulat kan, bau pun dah lain macam, rasa pun dah lain macam, jangan makan lah. Kadang-kadang leftover food kan, kita makan itu jadi food poisoning tu. Food poisoning biasanya akan ada dengan fever lah, very severe symptoms lah, fever, vomiting and so on. Okay, common mistake number 1 is not getting early treatment. Okay, this is hadis, I think you know better than me lah. Okay, kena berubat lah. Okay, next slide. Kena treat awal, get early treatment. Poor personal hygiene, not practice proper habitual hand wash, not wearing mask macam saya sebut tadi, not practice cough ethic. And number 6 yang banyak orang ni adalah antibiotik kan. Antibiotik memang biasa. Kalau batuk sikit, doktor saya nak antibiotik. Doktor saya, this one is not good practice. Okay, antibiotic is not ultimate treatment for all diseases. Kan, usually kalau just coughing for few days, usually viral infection. No need antibiotic. This one if you practice take antibiotic, this one very harm to you lah. It can cause antibiotic resistance, and so it will kill your probiotics in your gut. This is very big topic. So we as medical officer will decide to you when to start antibiotic. Okay, I think that's all from me. Back to Brother Muhammad Omar.
Thank you, Doctor, for the explanation. So there's a few tips given, as been mentioned earlier. First one is personal self-hygiene and also the environment. Avoid close contact. Avoid sharing things, especially personal things. Wash hands thoroughly. That should be at least 1 minute. Good ventilation, vaccination, mask that we have learned two types of masks, non-medical and also medical. Cough etiquette or ethics, prevention vector-borne, precaution when traveling to high-risk place, and also prevention on STD or blood-borne. So the second round, our second panel, question to Dr. Noor. Dr. Noor, could you elaborate on a few important factors that individuals can adopt to enhance their overall health and resilience against diseases?
Okay, thank you very much, Mr. Moderator. Can I have the next slide, please? Right. Okay, let us now focus on the effects of lifestyle and nutrition. Tadi Dr. Zuhdi dah cakap kebersihan diri, personal hygiene tu is very, very important because that is actually common sense. But unfortunately, common sense is not common nowadays. Saya pernah ke bilik, sisters, yang sebetulnya tidak boleh dimasak di dalam hala, tetapi dia beli electric cooker, dia masak Maggi dan makanan lain, tetapi tidak basuh berhari-hari, bilik dia kotor dan dia tidur sebelah periuk itu sahaja. Can you imagine? Ini cerita di mahala perempuan. Di mahala lelaki pula, meja study di dalam bilik tu boleh dipenuhi dengan tepung sebab dia buat dumpling atas meja belajar dan ada kertas test dia dekat situ dan ada sikat dia dekat situ. Dia makan dumpling perisa rambut ke apa? Macam mana kita nak buat ni? So macam-macam subhanallah yang kita tak boleh imagine. Tapi bila kita merakyatkan student, buat mahabah visit, macam-macam lagi yang kita dapat. Dan kita tanya, bila pergi kelas, semua orang boleh nampak kacak dan cantik, tetapi dalam bilik, seperti puting beliung yang berlaku. So you do not portray the image of what you show to people, right? Live simply, adakan sikit barang dalam mahala, so that you can actually manage yourself. Ini untuk kemaskan satu kompartmen, belum lagi kemas satu rumah seperti ibu dan ayah kita. Right now. Next, please. Let us focus now on halal nutrition. And ulang kaji sedikit what is haram yang semua kita dah tahu tapi kita kena diingatkan. Now human lifestyle has powerful effects on the diet and nutrition, and a suitable lifestyle helps to improve nutrition, which prepares essential nutrient without obesity and other metabolic disorders. Now, social, economic, educational, ethnic and cultural background, and briefly lifestyle influence the diet and may positively or negatively affect an individual's nutrition status. For example, the nutrition-related recommendation in Islamic texts may be regarded as the nutritional lifestyle in Islam, Qur'an, our holy book. It is not a medical book. It is not a biological book. It is not a nutrition book. But it has mentioned important guidelines. Allah has mentioned there points and examples related to human nutrition, such as the importance of nutrition and its effect on human life, diversity of nutrient and their classification as material. For example, plants, meat, animal material, meat, milk, etc. Halal, permissible food, haram, what are the foods that are forbidden. Semua dah ada kat situ. And the necessity of fasting during Ramadan pun Allah dah mention. The necessity of carefulness about foodstuff usage and evaluating of the benefits and harm of potential food. Forbidding of overreacting and food extravagance. Beli macam-macam tapi tak termakan. Bazir nama dia. And finally, therapeutics effects of honey. Kan? Zat-zat makanan ni apa dia punya kebaikan. Semua Allah dah mention. Maka bila Allah mention dalam Quran, benda tu bukan main-main. Penting lah tu. So kita jangan ingat kita orang Islam, kita tahu apa itu halal, kita dah boleh makan makanan halal, kita dah safe. Tapi tengok kepada trend pemakanan sekarang. Saya bagi contoh. Dulu bermula dengan pisang goreng. Lepas tu in trend pula kita ada pisang goreng with cheese. Lepas tu sekarang kita ada pisang goreng tak cukup cheese. Leleh pula tu. And then now we have pisang goreng cheese leleh drizzle with chocolate. Itu bukan makanan. Itu sampah. Dulu orang makan nasi, orang makan sayur-sayuran. Sekarang orang makan samyang. Sekarang orang makan all those burgers dan sebagainya. Dan buat rutin pula tu. What kind of trash are you putting in your body? Lepas tu kita nak guna badan kita untuk puasa, kita nak guna badan kita menghadap Allah nak solat tarawih ni. Kita cakap tak serupa bikin. Kita kata nak masuk syurga tapi kita buat syurga tu macam Disneyland. Orang kalau tengok kita orang kata macam ni ke orang Islam? Amalkan pemakanan yang tak dalam Quran kata. Ni saya merujuk pada diri saya sendiri, kepada keluarga saya sendiri. Yang kita kena nasihat acap kali anak-anak semua nak kena bentuk pemilihan sihat dia macam mana. Sehingga kan bila dibesar macam kamu dah jauh daripada mak ayah, buat pemilihan sendiri di mahallah tu. Right, next please. Kita tengok pasal halal. Halal ni subhanallah berasal daripada ha, lam lam. Tetapi the derivative of it, kata terbitan daripada tu, macam-macam bentuk dalam Al-Quran. Tambahlah, ambil kalkulator, 20, tambah 1, tambah 1, tambah semua. Tak sikit ke Allah cakap pasal halal? Apa maksud halal? Permissible, mengikut syarak. Merujuk kepada sembelihan terutamanya. Now, in essence, makanan yang halal semestinya dia tayyib. Apa pula tayyib? Revise balik selepas ni. Kita tengok pula next slide. In essence makanan yang halal itu ialah tayyib. Now, tetapi di dalam trend pemakanan kita yang berubah sekarang ni, makanan yang halal boleh jadi tidak tayyib. Kenapa? Walaupun dia halal, secara esensnya haiwan halal, disembelih halal, tetapi diproses, diletakkan bermacam-macam ingredient aditif dan digoreng, dimasak dengan cara yang tidak dapat kamu bayangkan, yang menjadikan dia tidak sihat dan mudarat, itu tidak tayyib nama dia. Jadi sekarang ni makanan yang halal, yang ada logo halal tu, kamu kena fikir-fikir nilai-nilai. Adakah dia junk food? Kalau junk food walaupun dia dapat pensijilan halal tetapi dia tidak tayyib untuk badan, untuk kamu, makan selalu. Sekarang ni kita ada vegetarian meat. Buka-buka tengok ingredient, ada 20 ingredient dalam tu. Meat, apa? Kalau meat lah. Kalau vegetarian meat, 20 ingredient tu apa? Semuanya ingredient aditif palsu. what kind of things are you adding to your food? What kind of things are you adding to your body? Ya, so thayyib dekat sini dia bermaksud apa? Kalau tadi halal, kalau tadi halal menurut syarak, mengikut syariat semua, so now thayyib ni dia fokus kepada pure, clean, wholesome, excellent, fit for consumption, safe. Jadi bila kita pergi kat supermarket, contoh kalau kita dapat daging Australia dan daging Malaysia lokal tetapi ada logo pensijil halal dan sebagainya. Kadang-kadang kita akan pilih imported lah, baru kelas sikit. Kan? Walaupun imported tu tak ada logo halal kadang-kadang. Kenapa macam tu? Sebab kita dah downgrade perkataan halal tu. Kita dah tak pandang thayyib tu apa. Now, halal is supposed to be mean premium. Halal is supposed to be mean safe semua. Yang tertinggi. Standard yang tertinggi. Tetapi kita yang merendah-rendahkan status halal tu. Kita siapa? Orang Islam. Sebab kita rasa premium tu lagi best. Halal ni halal je lah. So now, that's why saya kata, burger yang kamu makan kalau kamu makan setiap hari, Maggi yang kamu makan kalau setiap hari dan sebagainya, yes kita ada masalah keuangan dan sebagainya, tapi kita ada banyak alternatif. Kamu tak payah sampai masak dekat dalam bilik. Kamu hanya sediakan beberapa ingredient dalam bilik. Contohnya kalau kamu beli telur, you have your kettle. Boleh jerang air, masukkan dalam a bowl, letakkan telur 2 biji, tutup. That 2 eggs could actually fuel your day. Beli roti sikit, beli roti yang whole meal, beli salad-salad kalau selalu pergi Tesco, teman kawan-kawan dan sebagainya. Tak payah beli yang salad yang mahal-mahal tu. Beli salad, carrot dan sebagainya. Sediakan sedikit olive oil. Kalau tak ada olive oil pun tak apa. Sediakanlah apa-apa yang contohnya pisau pemotong dan sebagainya. Tak perlu masak. That is actually a powerhouse. Can make you not feel hungry at a longer time. Sekarang ni Ramadan tak nak datang. Budak-budak kadang-kadang tak sahur. Sahur pukul apa? 12, pukul 1. Itu bukan sahur. Itu siapa? Macam mana nak tahan? Pukul 10 pagi dah lemah dah. Orang tengok orang puasa sepatutnya lagi kuat. Tapi kenapa kita lemah macam tu? Sebab tak makan. Adakah itu reason dia? Tak, sebab kita yang tak tahan. Jiwa kita yang tak kental. Itu sugar. Sugar tu gula. Gula tu sugar. Ulang balik. Bukan syurga. Makan banyak-banyak gula, minum banyak-banyak gula tak membawa kita syurga. Itu mendekatkan diri kepada Allah, saya kata. Sebab apa? Dia minum minuman yang manis, alamatnya cepat potong kaki. Bila potong kaki, cepatlah menghadap Allah. Kita nak jadi macam tu kan, menghadap Allah dalam keadaan yang tidak bersedia dan amanah dia pun dah terpotong separuh yang kita tak jaga. So be careful, makanan yang halal sekarang ni boleh jadi tidak taib because of dia punya processing. Next. Okay, halal and taib. Sekarang ni kita tahu halal and taib ni ialah sesuatu yang overlapping. Okay, just nilaikan tak semua yang halal itu taib mengikut kepada cara masak dan pemprosesan, perakhiran dia tu macam mana. Now di antara halal dan taib, ya, ada satu yang kita panggil syubhah. Yang kita tak pasti, rasa ragu-ragu itu. Tapi kadang-kadang rasa ragu-ragu sebab benda tu trend dan viral, orang nak rasa. Okay, so hati kena kental sikit. Kita tahu halal, kita tahu haram. Kalau letak contohnya seekor khinzir lah kat depan kita, kita kata, oh tak, kita tak makan. Tapi tahu tak khinzir itu ialah haiwan 1000 guna? Nanti saya ceritakan. Haiwan 1000 guna itulah yang Allah bagikan sebagai dugaan kepada kita. Kalau kita nak tengok dalam kehidupan kita, haram ni sikit, ciut je. Yang halal tu yang hijau, nampak besar. Tapi masalahnya kita nak try juga yang haram tu. Kita nak try juga yang syubhah tu. Walhal there are so many choices yang halal. Kalau kita faham in the essence dia. Next slide please. Pig and its derivative. Daripada hujung telinga, boleh dikatakan hujung bulu sampai ke hujung kuku. Semuanya ada guna. Peluru dalam cat, dalam makanan, marshmallow, segala makanan-makanan yang berjeli-jeli, ice cream. Ya, semuanya ada, boleh jadi ada bahan-bahan yang tidak halal. Tapi kita tak nampak sebagai seekor khinzir sebab dia dah diproses. Jadi putih benda tu, jadi serbuk, jadi lemak. Kita dah tak tahu. Ya? Right? So inilah bahayanya sebab kita tak nampak benda-benda ni, kita rasa macam enteng je benda ni. Now this is very, very important. Next slide please. Next slide. Yes. Now, satu cara untuk kita memilih makanan harian kita ialah Malaysian Halal Logo. Sekarang ni kita ada banyak kedai-kedai yang baru dibuka di UIA. Saya tak naklah kata nama kedai apa. Kedai Tut dan Kedai Tut. Kan? Right? Boleh nak masuk, boleh nak minum, boleh nak makan dan sebagainya. Tapi belik-belik lah ada tak logo halal. Ya? Memang ada kes-kes penipuan logo halal dan sebagainya, tapi itu kita serah pada Allah. Tanggungjawab kita, kita perlu memilih yang halal. Paling mudah untuk mengajar kita memilih yang halal ialah ada halal logo. Tapi ingat, selepas tu kena nilai balik. Ini ialah jajan ke? Kalau jajan, walaupun dia halal, kalau kita nak makan sekali-sekala tak salah. Tak salah, bukannya haram. Makanlah sekali-sekala, tapi bukan selalu. Kita masalah sekali-sekala, 2 kali, 3 kali berkala-kala. Bila nak stop? So kena hati-hati. Ya, kena ada jati diri, kena ada sedar apa yang kita buat, apa yang kita letak ni badan amanah Allah ni. Tak lama. Macam mana nak kenal logo halal JAKIM? Tak semestinya warna hitam Logo halal Malaysia ni boleh berubah warna mengikut packaging tersebut. Tapi yang paling penting kena ada ni. Kena ada 7 ciri-ciri ni. Sebab kadang-kadang ada logo halal palsu yang bintang sepatutnya 2 kiri kanan, dia letak 1 je. Yang Malaysia tu tiba-tiba A hilang. Kena belik-belik betul-betul. Right, next. Next please. Apa jadi kalau produk-produk tu tidak mempunyai logo halal Malaysia tapi dia ada logo halal badan luar negara? Now, di website JAKIM ada satu PDF yang kita boleh download. Ada badan-badan luar negara yang Malaysia iktiraf. The certified halal bodies which is recognised by the Malaysian authority. So, kadang-kadang dia tak ada halal JAKIM. Contoh macam Samyang, dia ada halal Korea. Tapi hati-hati, ada beberapa sahaja halal Korea yang diiktiraf oleh Malaysia. Bukan semua logo halal di Korea itu diiktiraf oleh Malaysia. Tidak diiktiraf bermaksud macam mana? Malaysia tak dapat pantau cara dia berikan sijil penghalalan tu macam mana. Adakah one man show, dialah punya company, dialah nak pergi audit, dialah nak pergi halal. Jadi apa yang dia nak? Dia nak duit sahaja. Ya, so benda ni dia dah jadi marketable di luar negara sebab halal market is very huge and very big. Okay, so these are the things. Ada 86 certified halal body di seluruh negara. Kalau kamu nak beli cheese contohnya, memang takkan adalah cheese yang ada logo halal Malaysia. Sebab Malaysia is not producer of cheese. Kan, kita lembu pun tak banyak. Ya, apatah lagi nak hasilkan susu. So, semua cheese kita lah cheese imported, but pilihlah logo-logo halal yang diiktiraf oleh kerajaan Malaysia insyaAllah. Next please. Okay, ni kita dah tahu tadi macam mana nak jadi pengguna-pengguna yang halal dan tayyib dan yang bijak ni. Sekarang ni, saya nak kamu semua tanya dalam-dalam pada diri kamu, kenapa kita perlu kepada produk yang halal ataupun makanan yang halal dan tayyib ni. Kenapa? Nombor 1, percayalah makanan yang bersih lagi suci impacts our personality. Number 2, it impacts individuality development, cara kita berfikir. Ya, rangsangan kita bagaimana, pembesaran kita bagaimana, it affects the quality of our body. Macam saya kata tadi, sampah yang kita letak dalam badan kita, mana badan nak kuat? Allah lebih menyayangi seorang Muslim yang kuat daripada seorang Muslim yang lemah. Nak jadi kuat, nak jadi cantik, Allah sayang kepada kecantikan, Allah sayang kepada kekuatan. Tapi kita sendiri lemah, tak nak jadi macam tu. Kita sendiri cap ayam, tak nak jadi macam tu. Kita orang Islam, Allah pilih Islam ni. We are international Islamic university. Kita sepatutnya kena set very high standard. Then it affects our mental development. Ya, ini sangat-sangat penting. Sekarang ni ada banyak-banyak case anxiety, depression. Yes, if you really need help, please meet a counsellor. Please, rujuk kepada klinik dan sebagainya. You need to get help because there is unseen wound dekat situ. But at the same time, kamu kena sedar bahawa pemakanan yang baik ini juga membantu untuk kita tidak depresi terlalu banyak, membantu untuk kita tidak terlalu anxiety selalu. Ada makanan-makanan yang menenangkan, cheese, susu, pisang, brokoli. Banyak lagi. makanan-makanan yang mengandungi tryptophan dan sebagainya. Dan apabila kita memilih yang halal, itu sebenarnya satu jihad yang kita tunjuk kepada Allah, ya Allah, aku hamba-Mu yang lemah, tapi aku sentiasa mencuba, ya Allah. Mencuba apa? Mencuba memilih makanan yang halal, ya Allah. Ya Allah, berkatilah hidup aku, ya Allah. Nah, orang-orang soleh sentiasa mencari jalan untuk mendekatkan diri dengan Allah walau dengan apa cara sekalipun. So kita jangan lepaskan peluang ni, jangan lepaskan peluang ni. Then finally, righteous practice superior qualities of SATF ni apa? Now, bila kita dah biasakan dengan yang betul, maka boleh jadi kita akan ada kualitis-kualitis yang Rasulullah nak. Siddiq, amanah, tabligh, fatunah. Itu antara sifat-sifat Rasulullah yang perlu kita contohi. Siddiq apa? Benar. Amanah apa? Jujur. Tabligh apa? Menyampaikan. Kita ringan hati nak menyampaikan. Walau sepatah kata yang baik pun kita dengar. Yang fatunah tu apa? Bijaksana. Bijaksana dalam kehidupan, bijaksana dalam membuat pilihan. Kita semua kena doa kepada Allah, ya Allah, bimbinglah aku untuk membuat pilihan yang tepat di dalam hidupku, hatta dalam memilih makanan. Next. Thank you. That's all. So make sure, think halal and be halal, everyone, and live halali. Okay. Saya pass kepada moderator kita.
Barakallahu fikum, Doctor, for the explanation. So I guess the main component for these rounds, what we have to observe, the first thing is halal food, and it doesn't stop there. We also have to observe it whether it is tayyib or not, because it is what Allah asks us in the Qur'an. And as been mentioned earlier by Doctor, the halal food is supposed to be premium and safe, but in this modern society, we have to take more precautions, not just stop on halal food. And also we have touched about the need to eat halal food. It impacts personality development, quality of the body, mental development, etc., etc. So yeah, I guess that is for our 2 rounds. So now we would like to open for the Q&A session. As what has been mentioned earlier, if you have any question, either you can raise your hand and switch on your mic, or you can leave your question inside the chat box and I'll read it out, inshallah. While waiting for other questions, maybe I can ask my personal question, maybe to our both panels tonight. Speaking of about STD and also HIV, there's been a debate on the social media before about HIV PrEP given to the who has been sexual intercourse, maybe illegally. So my question is for Doctor, what's your take on this issue, ethically and also from the view of our religion?
Hello, Assalamualaikum. Sorry, tak berapa soalan tadi macam mana?
About HIV PrEP yang orang debatkan sebelum ni.
HIV.
Jelas ke?
Not very clear lah. HIV?
HIV PrEP yang sebelum ni orang debatkan tentang bila satu pasangan yang mungkin tak halal tapi cuma buat sexual intercourse, kemudian dia pergi pada klinik, certain klinik, untuk jangan dapatkan injection untuk prevent HIV tu.
Prophylaxis. Okay. Alright, okay. Okay, regarding this one that means post exposure lah. Post exposure HIV kan. Okay, actually this one memang ada lah. In our clinic we don't have lah. Di our clinic we don't practice this one. Dia panggil post exposure prophylaxis for HIV. But in term of macam mana nak kata in term of Islamic perspective, ialah of course lah kita nak prevent the disease kan. Tapi in term of haram tetap haram lah. Haram tetap haram. Cuma kita what we call this one, macam mana kita nak cakap just prevention for the disease. Tapi for me saya tetap berpegang pada prinsip macam Dr. Noor cakap tadi lah. halal. Nombor satu ada halal. Kan? Halal and thayyib. Is sama juga macam sexual punya relationship macam I cakap tadi at the first place, maksudnya kita kena pick for the safe sexual punya intercourse, safe and halal. So kalau kita nak menggalakkan, it's not macam kita nak menggalakkan macam buat zina dan sebagainya, tapi dia lebih kepada sometimes kita nak prevent disease from spreading lah. That's my answer lah. In terms of medical, yes, we have that kan dipanggil post exposure prophylaxis for HIV. Tapi in terms of religious practice, I tetap berpegang kepada prinsip safe and halal relationship. Mungkin Dr. Noor ada nak tambah something?
Tak ada doktor, saya pun baru je dengar pasal kes macam ni. Well basically benda ni memanglah tidak sangat di-agree oleh Islam, tidak di-accept pun sebenarnya. Right? So kita tak boleh nak menggalakkan sebab nak membolehkan benda ni. So the stand is the stand, but in medical we have to do some certain preventive measures. So memang tidak salah lah untuk dilakukan beberapa orang kata apa steps begitu. But the thing is the answer lies within the pelaku tu sendiri. Sebab kita walau apa condition pun, saya tak boleh nampak kamu buruk, saya tak boleh nampak sesiapa pun buruk. Yang paling buruk di mata kita ialah kita sahaja. Sebab kalau kita menuding jari pada dia, macam kita ni maksum. So kalau benda tu dah jadi, of course we have to take steps on how to prevent it further, which what the medical lines are doing. Tetapi ini tidak mewarrankan untuk orang tu buat lagi. So as simple as that lah. Mohon kita dijauhkan daripada Allah, daripada tersalah langkah dan sebagainya. Jadi sebab tu kita kena mengamalkan, menutup pintu-pintu zina ataupun apa-apa. Baik daripada, saya ada baca satu kajian STDs ni sebenarnya, sexually transmitted disease ni sebenarnya sangat kurang di dalam pasangan berkahwin. Dia sangat tinggi di pasangan yang haram dan especially same gender, lelaki dengan lelaki dan perempuan dengan perempuan. Itu sah-sah Allah dah kata no. Tapi bila kita buat, adalah musibah dia. That's all daripada saya, Doktor.
Ya, betul. Cuma nak tambah sikit lah brother Omar berkaitan soalan tadi. HIV ni kalau kita tengok kan, HIV saya pernah jumpa satu student few years back lah, masa saya mula-mula masuk UIA. Student ni datang, dia nak buat blood test. Doktor, saya dah buat blood test. Saya kata, nak buat blood test untuk apa? Saya ada appointment dekat Hospital Sungai Buloh. Dia cakap, Sungai Buloh ni, kalau tahu Sungai Buloh ni biasanya antara center untuk infectious disease lah. So bila saya tanya, then dia admit lah dia memang ada HIV. So tanya daripada bila lagi? Macam you boleh dapat HIV? So, rupanya daripada CFS, bila dia dapat duit untuk macam scholarship, something like that lah, macam duit, allowance dan sebagainya, dia guna tu untuk, sorry to say, dia pergi ni lah, hooker lah, dia pergi melanggan hooker, pelacur, masa kat CFS lagi. So I'm disappointed. Masa first saya masuk UIA dulu, I ingat kan macam, yelah Islamic history, bukanlah I nak judge all the student, tapi ada juga macam tu, which is I surprisingly, I dulu kerja kat KKM kan, so bila masuk UIA ni kita ingat tak ada lah benda macam tu kan, tu macam wow, that's first case yang I jumpa lah. Yang second tu yang tadi lah anal ward kan, dia gay, lelaki dengan lelaki, male MSM, male sex with men, same gender. Okay, alright. So macam saya tadi lah, in terms of medical, ialah kita buat kerja as medical, tapi kita bukan bermakna kita nak encourage zina tu untuk berlaku lah, for me lah. Alright, back to moderator.
So brother raised his hand just now. Maybe you can ask your question. Or anyone else who have questions, you may raise your hand and switch on your mic.
Fatin ada tanya soalan.
There is a question in the chat box.
So I read the question first. For the viewers in YouTube, My question is quite long, sorry. First, I once heard that we will experience chickenpox at least once in our life. If we already experienced chickenpox and then after some time we get contact with chickenpox patient, do we will get infected again? From Noor Fatih.
Okay. Soalan untuk saya kan? Soalan untuk saya.
Ya,
Okay. Chickenpox basically. Chickenpox ni kita panggil
sorry doctor. The sound got stuck. No doctor, still can't hear. Ataupun mungkin doktor boleh leave lepas tu masuk balik.
hello.
Okey, dengar tak?
Dengar Ahmad saya ada problem sorry. Okey, soalan tadi maksudnya dia tanya pasal chickenpox kan? So soalan tadi macam mana Brother Umar? Dia yang saya faham tadi based on the question, can patient infected twice by chickenpox? Kan?
Kalau kita kena, dia boleh kena semula tak?
Okay, basically chickenpox ni once in a lifetime. Maksudnya sekali you dah kena, the virus become dormant in your body. So maksudnya contoh masa kecil you pernah kena kuman ni kan. Kuman ni nama dia varicella zoster virus. So bila you kena, dia punya manifestation dia adalah skin manifestation. Dia akan jadi blister, dia akan jadi macam bumps, so very itchy lah. Ada fever dan sebagainya. So duration of the illness usually between 5 to 7 days. Alright. And then dia punya contagious period dia adalah during the blister time. Masa dia jadi blister tu. And then when it get crusted, dia jadi keras, dia jadi kering, that one dah no more infected lah. So can be infected by two method. Number one is close contact, you touch the patient, and also by droplets. So bila you dah kena sekali, virus akan become dormant. So the dormant virus, after sometimes, bila dia dormant, and then at particular time when your body get immune system weak, that time you punya virus boleh wake up and cause something we call shingles atau kayak. So actually kayak ni adalah dormant virus daripada varicella zoster. Okay. So theoretically you tak boleh kena dua kali chickenpox. Cuma ada certain clinical features dia akan mimic lebih kurang sama macam chickenpox. So ada type of viral infection will mimic chickenpox because usually kita akan diagnose chickenpox by clinical features. Alright, so kita biasa jarang kita ambil darah lah. So kita clinical feature, this is chickenpox, this is chickenpox. Okay, cuma bila you kena sekali lagi tu, okay, you assume this is chickenpox, maybe there is another viral infection lah. Okay, so theoretically dia tak boleh kena 2 kali lah, itulah saya punya respon lah. Okay, harap menjawab soalan lah.
Okay, is there any other questions? So there is another question from Aliana Jiha. My question is, how does antibiotics works differently from vaccines?
Okay, antibiotik, okay macam ni. Okay, antibiotik actually dia kita gunakan untuk bacteria infection. Okay, bacteria infection. Contohnya patient, okay, bagi situation So contohnya patient, you ada fever, you ada cough, kan? And then coughing macam dah few days, kan? Kita dah treat symptomatic still tak okay. Your hospital pun dah bertukar colour daripada ada
Sorry, Sister Izzah, can you mute your mic? Sister Izzah Ismail.
Okay. Alright, sambung balik So antibiotik, dia tanya tadi antibiotik versus vaksin lah. Okay, antibiotik ni kita bagi untuk bacteria infection. Okay, bacteria infection contoh dari bagi situation tadi lah, patient come with fever, prolonged cough, dia punya kita dah treat symptomatic which is kita bagi ubat dan sebagainya, hydration, cuma symptom tak settle. And then dia punya phlegm pun dah tukar colour from white to greenish contohnya. Okay, kita buat x-ray contohnya, x-ray nampak tak cantik, so kita start antibiotik lah. Alright, that one untuk bacterial infection. Vaksin pula, vaksin ni contohnya kita cerita pasal vaksin COVID lah, for example, COVID kan. Vaksin ni actually kita cucuk something kita panggil part of the kuman tu, kita introduce masuk dalam body kita, part of the kuman, macam contohnya inactive punya kuman lah yang pertama. Ada juga kita ambil part of the kuman, dia panggil mRNA punya vaksin lah, macam Pfizer dan sebagainya. So kita cucuk masuk dalam body, so kita punya immune system akan respon. Masa kita train kita punya immune respon tu untuk jadi macam komando lah, special force. Dia panggil adaptive, cellular adaptive immunity. So dia akan develop certain special force untuk kita panggil untuk immune system tu. So next time kalau you betul-betul expose kepada kuman, contohnya kuman COVID betul-betul masuk, so you punya tentera dah bersedia dah, komando dah bersedia, siap sedia dah untuk lawan. Tapi kalau you tak vaksin, okay, you tak vaksin contohnya, you hanya depend pada innate immunity saja, historically macam tu lah, you depend pada innate immunity saja. Bila dia betul-betul masuk, especially kalau yang high risk punya patient, so bila dah masuk baru nak train komando, baru nak buat training kan, nak hire special force, dia akan ambil masa lah. Dah kuman tu dah merebak dengan berleluasa dah waktu tu. This is the idea of vaccination lah. Of course ada side effect, ada patient yang experience side effect macam allergic reaction, ada cases yang reported pericarditis, myocarditis, ada certain cases. Okay, memang ada, saya tak nafikan. Cuma macam kita tadi lah, bila kita nak train, when we want to do something, I tak cakap vaksin ni totally perfect. Dia ada dia punya defect juga somewhere kan. Macam juga kita dah punya life kita ni, kita banyak depend pada risk lah, risiko. We are depend on risiko lah. So kita kena ambil weigh and benefit and dia punya disadvantage dia. So maksudnya kita vaksin basically kita nak train kita punya immune system untuk develop special force. Antibiotik kita nak bagi pada waktu itu untuk bacterial infection. Macam tu lah lebih kurang. So kalau you bagi antibiotik untuk COVID patient tak boleh lah. Sebab COVID is viral. Kita bagi antiviral. Contoh patient tu immunity lah, kita bagi antiviral. Dia ada sekarang ni COVID, kita ada ubat antiviral yang khusus lah. Macam Paxlovid sekarang ni. Paxlovid, ubat antiviral lah. So this one kita panggil passive. Kita hantar, kita bagi terus pada ketika itu. Kita tak train dah, kita bagi terus. Komando terus cucuk masuk. Dipanggil ubat antiviral. Hope answer your question lah.
Thank you, Doctor. Supposedly that will conclude our Q&A session because we have reached our time. But maybe we can just answer this question short and sweet. Doctor, I'm curious regarding the HIV infection. If the person changes their partner in haram relationship, how frequent does it take for the disease to transmit or be created?
Oh, ni susah kan jawab soalan ni. How frequent kan? Dia ideally I don't know how frequent. How frequent maksudnya berapa kali nak buat hubungan seksual baru dapat kan. Basically secara teorinya macam contoh you buat sexual intercourse dengan satu pasangan. Possible you boleh dapat terus HIV. Cuma dia dipanggil window period. So window period ni macam mana? Contoh you buat hubungan seksual dengan satu patient. Saya pernah dapat satu student baru ni. Sorry to say, this one related student. Dia datang, dia kata dia conscious, doktor boleh tak saya nak buat test HIV? Dia kata kenapa dia nak buat test HIV? Rupanya dia dah berzina dengan seorang perempuan lah, yang dia tak kenal pun. Macam-macam boleh kenal perempuan ni, saya tanya. Dia kata dia kenal melalui online macam tu je. Lepas tu jumpa dan buat hubungan lah. So dia concern sama ada takut budak tu ada HIV atau tidak. Cuma bila contoh you expose, contoh dengan satu patient HIV, then takdir Allah memang kuman tu masuk dalam body you, dia panggil window period. So window period usually dalam 3 months. 3 months tu kita tak boleh kesan lah kuman tu. Okay, kita 3 months kita tak boleh kesan kuman tu. Yang you cerita tanya tadi pasal post exposure prophylaxis, usually kita bagi 72 hours, within 72 hours after exposure lah. That's why kita tak buat dekat klinik lah, semua dekat facility KKM lah macam saya cerita tadi kan. So dia panggil window period bila you check memang tak ada. Window period memang tak ada. So after 3 months barulah kuman tu akan manifest. Dia akan jadi HIV. So berapa kali bertukar pasangan, berapa kali tu saya tak boleh nak jawab soalan tu berapa kali kan. Tapi kalau dengan sekali you buat, possibility tu ada lah. Possibility untuk kena tu ada. Macam tu. So that's why we emphasize, memang I totally agree with Dr. Noor lah. Macam memang kita kena practice Islamic punya teaching. Memang betul-betul lah Tuhan dah atur cantik dah hidup kita ni. Kan? Untuk cari yang halal kan, avoid haram kan, pilih pasangan yang kita panggil yang halal kan. So, sekarang pun untuk kahwin pun sekarang pun kita ada screening untuk infectious disease kan, HIV dan sebagainya, baru kita boleh kahwin dan sebagainya kan. So lebih kurang macam itulah jawapan saya.
Okay, thank you, Doctor. With that, we conclude our Q&A session today. So, moving on to our last round, that is for summarize. So, we start first with Dr. Zuhdi, a short and sweet conclusion for our session today.
Okay, for our session today, actually, the first things I want to highlight is about number one, how to avoid. Because today, bukan intention saya untuk ajar tentang medical. Okay, I just will give you brief idea lah apa penyakit-penyakit yang biasa datang kat klinik kan. Nombor satu adalah prevention wise. Very good topic lah. That means number one is personal hygiene. Personal hygiene very important. Practice good personal hygiene and practice lifestyle, very good lifestyle. This is very good. The topic that touched by Dr. Noor is Islamic way of lifestyle. Cara makan, pilih makanan halal dan thayyib. Sorry, saya sentuh sikit lah. So it's good combination between the practice good self hygiene dan juga good lifestyle. Yang betul is practice hand wash. Hand wash is sangat penting, especially kalau you ada coughing kan, you expose kepada patient dan sebagainya. Hand wash very very important. Number 3, cough etika batuk. Kalau semua orang boleh buat etika batuk ni kan, this is very good lah. Okay, janganlah batuk macam kita tunjuk kat video tadi kan, terus batuk without protection. Okay, pakai mask kan, proper mask application, cara pakai mask yang betul macam mana. Okay, boleh tengok dekat website banyak cerita tentang how to properly wear mask. Okay, get early treatment, very important. Get early treatment, jangan sampai dah few days dah demam, high grade fever, day 4, day 5 baru nak datang awal. Especially kalau you ada high grade fever. Kalau just mild fever mungkin boleh okay sikit lah kan, tengok progress. Tapi kalau high grade fever kena datang awal. Ataupun simptom-simptom yang teruk, vomiting ke, diarrhea dan sebagainya yang teruk, datang awal. Get early treatment, at least we can assess and then we give you next appointment lah. Early get treatment. Seterusnya adalah concern about your friend. Contohnya you duduk dekat bilik kan, kawan you tak sihat, kena concern lah kan, tengok dia tak sihat dan sebagainya, batuk-batuk, advise pergi klinik dan sebagainya. Kalau dia dia macam ni you assist dia, okay, nanti kita boleh tolong you call principal ke call fellow ke untuk assist dia quickly, ataupun call klinik kalau nampak dia teruk sangat kan, boleh call klinik minta our assistant. So kena concern, kita kena cakap pada kawan-kawan kita yang tak sihat ni. Dan juga precaution lah kalau you travel to high risk places. Okay, nak pergi camping ke tempat-tempat yang jungle, waterfall dan sebagainya, kena beringat ada penyakit-penyakit yang melibatkan contohnya malaria kan, dengue, leptospirosis, kencing tikus dan sebagainya. I think that's all lah to conclude. Prevention wise, it's very important. That's all from me.
Thank you, Doctor, for the brief conclusion. Next, Dr. Noor.
Thank you very much. Saya nak ucapkan terima kasih kepada Dr. Zuhdi kerana malam ni kita dah banyak belajar benda yang sangat penting, benda yang boleh kita terlepas pandang. Now, to all yang listening out there, kamu semua seperti anak-anak kami. Kita berada di dalam satu IIUM. We are all a family. Saya dengan Dr. Zuhdi takkan terima peluang ni kalau kami tak rasa sayang kepada kamu semua atas dasar Islam. Tak terima peluang ni kalau kami semua tak sayang untuk sampaikan informasi ni kerana Allah. Right? So, now we love Allah, we all love you, and now you should practice loving yourself. How to love yourself? Make a prevention action. Now kita dah nak masuk Ramadan pun, minggu depan Ramadan. Berbahagialah dengan kedatangan Ramadan. Maka harap-harapnya Ramadan juga berbahagia menerima kita di dalamnya. Whatever bad habits yang kita ada sebelum ni, please take this Ramadan as a new start. Orang tak tahu apa yang kita tak buat, orang tak tahu apa yang kita buat salah. Ya, Allah is always there, the most merciful, right? Apa-apa yang kita tak cakna sebelum ni, sekarang kita dah cakna. Now do it right. Start somewhere, start now. Start your Ramadan strong, finish your Ramadan strong, and be the best of version that you can be throughout this year and throughout. Yeah, making this Ramadan the best Ramadan that you can have. Yeah, so recap balik apa yang Dr. Zuhdi nasihat. If anything, try to prevent. Meaning that if you fail to plan, you are actually planning to fail. Apa-apa, take precautions. Then if you have any symptoms, go to the clinic as fast as you can. Right? Know yourself. Be aware. Be aware of your surrounding. Kawan kamu tidur ke, balik ke, makan ke, tak ke, sakit ke. Yeah, let us practice, caring for each other. Okay? So, all the best to all of you. Keep it halal, everyone. And my best dua to all of you. That's all. Assalamualaikum warahmatullahi wabarakatuh.
Jazakumullah khairan wa barakallahu feekum to both our panels tonight. So as a short wrap up for our session today, I would say that the main two things that have been emphasized a few times in our session today. The first one is about prevention. We have to live as what Islam asks us to live. We observe halal and also the 𝒖𝒏. And the second one is we must also observe and know the symptoms of few diseases, so that na'udzubillah min zalik, if we are infected, we can straightly get some help from the professional. So I guess that is the two main components for our session today. Brothers and sisters, we have reached our end session today. I would like to ask all of you to scan the QR code displayed on the screen for the evaluation form. We will give you a few minutes to scan and fill in the form. Now we are almost at the end of the program. However, this program will not be completed without a photography session to capture this memorable event. Therefore, I will pass the floor to our multimedia team to handle the photography session. So I would ask as many as possible to switch on the camera so that we can capture this moment together. So I will count on 3. We will just wait for a few seconds more. Okay, get ready everyone. On 3, 1, 2, 3. One more. 1, 2, 3. Okay, freestyle. Ready, 1, 2, 3. Okay, jazakumullah khairan, and thank you to all. But before we leave our meeting today, there will be a registration attendance form, sorry. So the participants have to fill in the attendance form. Alhamdulillah, we have now come to end of our forum, Infection Diseases, Let Us Prevent It. We really hope you found this forum informative and beneficial. On behalf of all the committee, we would like to express our utmost gratitude to all the distinguished participants and members of the floor for making this ceremony a success. We would also like to apologize for any shortcomings during this ceremony. As a reminder, again, please fulfill the attendance form link given in the chat box and also the comment section on YouTube before you leave this session. With that, I end. Have a good day, everyone. Ramadan Mubarak. It is coming shortly. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.